In a previous video, we discussed the region of the thigh, its cutaneous nerve, arterial and venous supply, and lymph nodes found in the thigh region. We had discussed how the deep fascia of the thigh divided the region into three compartments, that is, the anterior compartment, medial compartment, and posterior compartment. These compartments are also called the extensor, adductor, and flexor compartments, respectively. In this lecture, we will cover the anterior department of the thigh. The anterior compartment of the thigh contains the sartorius and the four large quadriceps femoris muscles, made up of rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius muscles. There is also a small muscle called the articularis genu. All these muscles of the anterior compartment are innervated by branches of the femoral nerve. In addition, the terminal ends of the psoas major and iliacus muscles pass into the upper part of the anterior compartment from sites of origin on the posterior abdominal wall. Although these two muscles are not considered to be part of the anterior compartment of the thigh, we will talk about them briefly as they do make up part of the thigh. These muscles are innervated by branches directly from the anterior rami of L1 to L3, psoas major, or from the femoral nerve, branch to the iliacus as it passes down the abdominal wall. The femoral artery and vein also pass through this compartment. Nerves, as well as the important vessels, pass through the region of the thigh. Injuries to this thigh may lead to compartment syndrome. It can occur due to increased pressure within the compartment, which can lead to decreased blood flow and damage to the muscles and nerves. Acute compartment syndrome of the thigh is rare. It's usually caused by blunt trauma and is often associated with femoral fractures. A high index of suspicion is necessary for a patient with a swollen thigh that has a minor trauma and a patient who is on anticoagulation therapy or a hemophilic patient. Clinical presentation of anterior compartment syndrome. Knee in extension attitude, meaning that the knee joint is straightened out and the thigh and lower leg are in a straight line. Severe tenderness over the anterior aspect of the thigh, but it is less over the medial aspect. Pain during passive flexion of the knee. This is because the quadriceps muscle is being stretched out after being extended for a long period of time. Weak extensor muscle leads to weak extension at the knee joint. And paresthesia refers to abnormal sensations in the skin, such as tingling, numbness, or burning, over the medial aspect of the knee, leg, and foot. In this lecture, we will get into the details of the anatomical structures found in the anterior compartment of the thigh or at the front of the thigh, such as the femoral vessel, the femoral artery and femoral vein, and the femoral nerve and its branches that innervate the muscle of the anterior compartment. But before that, we need to discuss two important anatomical landmarks found at the front of the thigh. These are the femoral triangle and the adductor canal. They are mentioned throughout the lecture in relation to the vessels and nerves, so it is better to learn about their structures, boundaries, and contents in detail. You may also get a question regarding the boundaries and contents of the femoral triangle. The answer to this question will be given in the next video.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.